Carpal tunnel syndrome is one of the most common problems that we treat. It typically causes numbness in the thumb, index, middle, and ring fingers. These symptoms can afflict people during the daytime as well as at nighttime, and usually come and go at the beginning. It can also, when it's in a more severe form, affect the muscles at the base of the thumb. Finally, one of the other more common symptoms that people have is a feeling of swelling, as well as sometimes even pain that radiates up from the wrist towards the forearm or even the elbow. If you're experiencing those types of symptoms, an evaluation by a hand surgeon can be very helpful in terms of not just progressing right to surgery, but making sure that you have received all of the proper treatments that can help improve carpal tunnel syndrome and in many cases resolve it without surgery. When surgery is necessary, and that's usually for patients who have symptoms that have failed non-operative treatment or interfere with essential activities for their lifestyle or job, then surgery usually can be done either in the office with local anesthetic, and it's done very comfortably that way, or in the operating room for patients who prefer that route. Depending upon the patient's underlying medical conditions, we may vary the type of surgery that is suggested. Oftentimes patients can have a very minimally invasive type of procedure with just a few small incisions or even at times just a few needle pokes. On the other hand, if a patient has had prior carpal tunnel surgery or has other underlying medical conditions that may warrant a more open approach, then we can do those for them as well. For every patient who has carpal tunnel syndrome, they will often experience pain in the palm with use for about 3 or 4 months. Now that's not pain at rest or pain with typing. I'm talking about pain when you're leaning up out of a chair or doing push-ups or going to the gym to lift weights. Most patients have very little significant pain and are back to doing most of their normal activities anywhere from 2 to 4 weeks after surgery. In general, we do like to limit activities for the first few weeks just to prevent complications. In general, if you're experiencing those types of symptoms, then coming in and being evaluated can often help determine, first of all, whether or not you have carpal tunnel syndrome, and then if so, to get you on the right track towards getting that treated properly and back to enjoying your life.